I can tell you is November is Diabetes Awareness Month, and this disease affects millions of Americans and their families.
Yeah, but Baylor College of Medicine is working hard to improve the lives of those living with the disease. Baylor College of Medicine doctors Brian Lipo and Miguel Montero are here to discuss symptoms, treatment options, and new technology. I think this is so interesting that promises to help. Hi, guys.
Great. Hey, how you doing?
Thank you so much for coming in. We do appreciate it. You know, I think what we should start off with, too, right now are just symptoms of circulation problems and non-healing wounds, because I think those are things that people commonly, right, come into play.
Absolutely. We have a very unique environment called the Toe and Flow environment, where we kind of work together as a combined team to manage lower extremity problems. And yes, there's a lot of our population that have non-healing chronic wounds stemming from diabetes and poor circulatory problems. So we're here to kind of help manage those problems in a more efficient manner.
And some of those wounds, by the way, that are not healing, they can be on the legs and feet, right? I mean, this is the kind of stuff that really affects someone's quality of life, because if their mobility, if they can't walk,
absolutely,
that's tough.
The numbers are staggering. Every 20 seconds, an amputation is being performed from diabetes-related complications, and from those amputations, the death rate is greater than 50% if you lose a leg. And so, our goal is to manage these wounds in a more efficient manner, so we can make sure that we keep those people active, living their lives, and walking on 2 feet.
Yeah.
Absolutely. And Dr. Montero, there's some great advancements going on at Baylor, correct?
Yeah, well, I think one of the main advantage is the fact that we've gotten the right team approach now, and we've created a group of interdisciplinary professionals that work together. So we got the podiatry, wound care specialists that know exactly what to do with all of these wounds. And then you have us as the vascular surgeons that actually offer the most, top of the line therapies to actually restore the blood flow, which is one of the biggest issues with diabetics, that they lose their blood flow to their feet.
I think it's so cool that you guys, as surgeons, you have all of these new tools that you can use and your patients can use to improve their quality of life. Can you show us some of the things you brought
absolutely. We're fortunate at the Baylor College of Medicine to have a lot of access to research, and with that, we have a lot of great things that we do. Some of these things include a special oxygenated type dressing, which is found to help expedite the healing. A dressing is attached to this, and the patient can carry this around on themselves, and it delivers direct oxygenation to a closed wound environment. You have specialized shoes and inserts that help to monitor pressure and help to reduce pressure. And basically, we want to link the consumer with technology, right? So we'll have inserts that will go inside the shoe and alert somebody if there is pressure, and that will allow them to help reduce that pressure by sending a signal to their cell phone.
And so basically, that's where that connection is made, right here on the side, correct?
Right. Connection is made here. This produces like a kind of a bladder effect. And what that does is help to improve circulation of the foot by acting as a massage mechanism. And studies have shown that it helps to increase circulation down to the foot and ultimately help to keep those wounds healed.
That's great. I love that. And I think too, a lot of people think that we've talked a lot about diabetes and now it's manageable, but this is really also preventable in some cases as well.
Correct, and that's really what we're trying to do here. I mean, we're trying to basically create a unique environment where we have the two of us and our partners working together to help manage the diabetic foot in a more efficient manner. We want patients to come into a one-stop shop environment where they'll see both the vascular surgeon and the podiatrist, get automatic evaluation, and typically, those patients are treated much more efficiently than they had been in the past.
And Dr. Montero, that really is key to increasing the healing process, right? All of those things together.
100%. One of the worst things that I get from my patients is saying, "Doc, I don't know where to go. They send me for this here. I got to take a taxi and go to this other facility for this other wound care, and it's just too much burden for my family and for myself." And I say, look, one-stop shop, come to us. We do everything from A to Z. We diagnose you, we treat you, we care for you like family, and we give you top-of-the-line technology. That's what we're trying to offer.
That's great. Dr. Montero, Dr. Lipo, thank you so much for stopping by.
Thank you, guys.
If you all would like, by the way, more information, you can visit Baylor College of Medicine's Facebook page at Toe and Flow, or you can call 713-798-5700.